2 years ago, a global pandemic ravaged the world's health systems, claiming lives and livelihoods in the process. And in an effort to contain the spread of the COVID-19 virus in the Nairobi slums, President Uhuru Kenyatta ordered the urgent construction of 24 Level 2 and Level 3 facilities in each of the informal settlements under the Nairobi Metropolitan Services, or the NMS.
Well, 15 of those facilities have since been commissioned in various locations around this city. But have these hospitals met the needs for which they were set up for? Have they changed the sorry state of healthcare in Nairobi slums? Well, tonight we revisit the NMS hospitals project to get answers to some of those questions.
It was at the height of the COVID-19 global outbreak in 2020 that President Uhuru Kenyatta gave an unprecedented order for the construction of hospitals in Nairobi's informal settlements to help respond to the pandemic. But for those living in Nairobi's 13 informal settlements, the hospitals were more than just a response to COVID-19. They needed improved access to health facilities and services to curb the spread of the new virus in locations where social distancing could prove a challenge. At about the same time COVID-19 landed in the country, President Uhuru Kenyatta had created the Nairobi Metropolitan Services (NMS) and appointed military officer General Mohammed Badi as its first Director General. The new city boss and the president began making night tours of the slums of Nairobi.
The first one that we visited was Uhuru Kenyatta, where there was a dispensary run by a Dutch Catholic that had a bed capacity of 7 beds, and this was only for maternity. That is when His Excellency, through the national government, ordered that we build all informal settlements a hospital each to take care of the need then of corona. And of course the maternity cases, because what he saw on ground was very sad, what was happening. People were given 1 hour to deliver and then go home.
But are these hospitals really serving the intended purpose? In our special feature tonight, Citizen TV investigates the situation in some of these Nairobi Metropolitan Services hospitals to find out whether the intended population of over 2 million is getting full medical services as anticipated. We explored the state of the ones offering complete health services. We zeroed in on 8 out of the 15 hospitals already commissioned. Posing as patients, we visited each of these hospitals, 6 during the day and 2 at night, to find out about some concerns on social media by city residents about poor service delivery in some NMS hospitals. It is 8:40 in the morning. The facility is not busy at all. The waiting bay is empty except for the receptionist. As we wait for further communication from medics present here, we are approached by 2 female medical staff.
We are not offering services. From 11 a.m. From 11 last week, we are not offering any services. You can even see for yourself the way the facility looks like. And the bosses are aware, we are waiting for them to act. You cannot work in such a dirty environment. Yes. They know the reasons why, and we are waiting for them to sort out the problem before we can commence on any work. So we go look for another facility for now, meanwhile.
We walk out wondering what would have happened if we were actually patients in need of emergency medical assistance. At exactly 8:45 a.m., we head out to our next destination, the Uhuru Health Center. The hospital is fairly busy. This medical staff directed us to a retail shop within the compound, where we first have to buy a booklet where our details will be recorded. This man attends to us at 9:25 a.m. And at 9:40, we are seen by a doctor who recommends a laboratory test for TB after evaluating our symptoms. We are then sent outside the hospital to a private laboratory for the same test at a cost of 500 Kenya shillings, since the test is not available at this Uhuru facility. Shortly after, we are called in. "10 minutes later, the result is out. We head back to our doctor at the Uhuru Health Center for review. After the review, she prescribes 4 different medicines and directs us to the hospital pharmacy to collect. The pharmacy attendant tells us that we could only get one of the 4 prescriptions, reason being the hospital has run out of drugs. Soweto Health Center in Nairobi's Kayole area is a level 2 hospital run by the NMS. From outside, it appears well organized with some hand-washing equipment stationed just at the entrance. We walk into the hospital building at 10:17 a.m. As usual, our vitals are taken and we are told to wait for a call by a medic in charge. At 10:40 a.m., we are seen by a medical staff for consultation. He advises us accordingly about the persistent headache and flu-like symptoms we just presented to him. He then prescribes 4 different drugs for us. At exactly 11:45 a.m., we walk out of the Soweto Level 2 hospital. On the second day, we visit 3 more hospitals: Ngomongo, Ngondokamulu, and Zimmerman Pickens Health Centers. The script is not different from the rest of the facilities we have visited so far. Free consultation services are offered, but drugs are either insufficient or unavailable for patients. At Ngomongo Health Center, we presented ourselves to the medical staff. Ngondokamulu is a level 3 facility meant to offer even inpatient services. Here, we also present ourselves to a medic for consultation. But this medical staff checks our booklet and informs us that the hospital does not have the drugs prescribed by the doctor. From here, we headed for the Zimmerman Pickens Level 2 hospital. Here, one of us posed as a patient. As a requirement to accessing medical services at all NMS hospitals, we are told to buy the small booklet before our vitals are taken. From here, she directs us to a consultation room upstairs.
So sana ni acidity ya plus inakuwa mingi. Hii nimeka star na hii hatuna. Utanunua hii na hii. Alafu uzinunue zote alafu utaanza at the same time. Okay.
In our quest to find out whether medical services are offered at night as well, we visited 2 NMS facilities, Isli and Uthiru Muthua Health Centers, on a Friday night. This is the outpatient wing of Isli Medical Center.
So usiku haifanyangi kazi?
Haifanyi kazi. Walikuwa wanafanya kitambo lakini sasa walisema corona akatoroka. Bila kazi December.
We also checked out the maternity wing of the same facility just across the streets. Here, we pretended to have a patient who is ready to deliver.
Ina operate 24 hours. So tunaweza leta mtu?
Yeah, saa ngapi ama hata kama ni saa ngapi. Yeah, unakuja tu na gonga ile mlango.
Atapata madaktari?
Wako, wote. Hapa ni kama polisi. Huwezi kosa mtu.
We left the Eastleigh Maternity Unit a few minutes past 10 p.m. for Uhuru Health Center. Upon arrival, we find 2 female staff and a security guard on duty. We present one of us as a patient. Nonetheless, she attends to us. After our own independent assessment of these facilities, we formally asked the NMS for an official visit to some of these hospitals. They proposed the Kayole Soweto Hospital, a facility we already filmed undercover, and the Kibra Level 3 Hospital to the list of other 8 hospitals we visited. The Kibra Level 3 Hospital is located at the heart of Kibra constituency. The facility looks very clean and quite busy. This is the longest queue we've come across at NMS hospitals during our assignment. Everything appears to be running like a level 4 hospital here. Dr. Nancy Aboya is a senior medical specialist here, and we inform her of the complaints by Kenyans.
We are still under NMS, and yes, they've been providing commodities. Everything. We have drugs, we have, when called gloves, masks, name it, medicines are there. So yes, we have commodities.
The maternity wing was also operating smoothly. We are told over 220 women have so far delivered in this facility.
Mimi nilianza clinic hapa na nikaenda scanning, wakaniambia nimebeba mtoto kijana, lakini haikuwa imekaa vizuri, wakaniambia nirudi tena for 1 week.
At the Soweto Kayole Hospital, at the pharmacy, a bit of change. The shelves are equipped with enough drugs today.
Mshaikosa dawa, mkatuma watu nje wanunue.
Sometimes you get a condition which is not included in the supply, and on rare cases we have to send them somewhere to go and to buy, or in the bigger facilities.
Cecilia Nduko is a patient here waiting to be attended to.
Naambiwa singine unaweza kuwa hakuna, naandikiwa tunanunua. In our pharmacy it is stocked with drugs. We don't have a problem really, but I know the NMS is working on adding more drugs because the population is really high.
This is the same hospital we visited few days earlier, and we were sent out to buy some drugs. A contradiction of what Lillian and Alicia told us. For further clarification on what is truly ailing the NMS hospitals, we reach out to the NMS boss, Director General Mohamed Badi. Badi claims when he initially took over Nairobi, out of over 4 million Nairobi population, almost 47% were flocking the Kenyatta National Hospital, KNH, for medical services, a situation that he says has now been turned around after NMS hospitals were put in place, cutting down the outpatient visits to KNH by 60%.
To what level are you satisfied with the service delivery?
Yes, to decongest again Kenyatta, we use our level 5 hospitals, the specialists in level 5 hospitals, to attend to these level 3 in informal settlements to do minor surgeries. We started with Uhuru last year, and they did 2 successful operations, and after that we do it on rotational basis based on the need that is required within those informal settlements.
I bumped into these complaints from Kenyans on social media that some of these hospitals do not have drugs. So we visited some of them, and unfortunately we also experienced the same.
We inherited a huge bill, and we have just finished paying off KEMSA last week, So that challenge too was there, and it's still going to bite into us because some of the medical suppliers that were supplying some of the county hospitals before NMS came have still not been paid up to date. So we have formed a committee, both from finance and medical, to look at the pending bills that are facing us. And it's not a small amount, they are in millions.
NMS had to pay 196 million shillings debt to KEMSA, a liability that has been curtailing enough supply of drugs to these hospitals, with another 100 million owed to the small medical suppliers still pending at the time of our investigation.
And unfortunately, some of these companies have even gone bankrupt because of these huge bills. So yes, we pity them because these were mistakes formed by the former county governments. But because health was a transferred function, it is now our problem to solve it. It's a headache that we inherited. We can't run away from it.
Yet, NMS is not only struggling financially in managing these hospitals, but also human resource-wise, despite having recruited almost 2,000 health workers.
Most of these level 3, level 2 hospitals were supposed to operate day only. But Wananchi reached out to His Excellency the President saying, you have built us so many hospitals, we can't get service at night. So again, a new directive was given to operate them 24 hours. So we are struggling now to get employees, new medical employees, to run those facilities 24 hours. We have worked a shift program that we are managing 24 hours to keep the hospitals open.
Do you think the rollout of these hospitals happened too quickly?
In fact, if you'd ask me, we are slow because we were supposed to finish all 24 hospitals within a year. And so far we have done 50. We have had challenges in space. In some areas we had to negotiate either to move our chief's office in order to build a hospital.
NMS has so far commissioned 15 out of the 24 hospitals ordered by the President, with 9 more to be commissioned. Safi Godanamamo, Citizen TV.